Rayan is a 5-month-old Caucasian male who presented for evaluation of a markedly elevated partial thromboplastin time that was first detected immediately following birth. The level of the factor IX was reported to be unquantifiable, possibly secondary to the presence of inhibitors. On repeated testing, the patient's factor IX level was found to be markedly decreased. An inhibitor screen was performed at this time and it was negative. The patient was born without complications by spontaneous vaginal delivery. The pregnancy was unremarkable. The patient had not bled since birth. But if we talk about his family history, the patient's mother was a symptomatic hemophilia B carrier with a factor IX level of 16%, and his maternal uncle had moderate hemophilia B with a factor IX level of 2%. Upon physical examination, there were no signs of any bleeding. These were the principal lab findings. Now the questions are, what are this patient's most striking clinical and laboratory findings? What factors should be considered in arriving at differential diagnosis for this patient? And what is the patient's most likely diagnosis? Let's dive into coagulopathies to find out the answer of our questions.